about a conversation that's kind of been warming up lately. Today I had a post on questioning whether or not your prolapse would get worse if you had more pregnancies. And that kind of crosses over with this topic that's been coming up lately about consent, and women having the knowledge to make decisions while they're pregnant about their delivery mode and postpartum and all kind of stuff. And it's a really interesting conversation. Consent to me implies that like everything is disclosed, and I consent to birth injuries, I consent to this, I consent to that. And I don't think consent's the right word. I think understanding risk, understanding, as much as possible. But I think there's this mindset that you have to take into account when you're talking to somebody who's pregnant and hasn't had a kid before. And I will put myself in that category. And that's that mindset that you hear stuff from other people and you're like, oh, well, that's just them. That won't happen to me. Or, how someone has issues with their kid or something. I'm like, oh, that's just them. That won't happen to me. We all do it, okay? Like, let's just be honest about it. We all do it. So I think we kind of have to step even like a bigger step back from like, almost like even before you consider pregnancy, or even just, I don't know. My whole thing is like, we really should start educating all kids about this stuff in an age appropriate way, much earlier on of, hey, these are what your organs are. They are not held in place by a hammock, but they have a support system, which includes fascia, and this is what fascia is, and includes ligaments, and includes muscles, and your muscles are like this. And instead of like the basic, your pelvic floor is pee, pooping, and sex, like, okay, great start, but we need to be a little bit more specific. And then go from there, because I think by the time you're pregnant, that ship has kind of sailed, that mindset is sort of kicked in. And so, I mean, you can sit there and have an OB tell you, okay, vaginal delivery, first time around, you're at increased risk of pelvic organ prolapse, and that's true. But again, we don't know what's going to happen during a vaginal delivery. There's a lot that we don't know. But the things that we can kind of have these discussions about ahead of time is, did your mom have prolapse or prolapse surgery? Did you have sisters that had prolapse or prolapse surgery? Like, let's talk about some of the genetic things that we can't control, but it will help us make a decision. Any other concerns that you might have? If you have indicators of high tone pelvic floor, do you need to address down training prior to vaginal delivery? We can talk about all the things that can occur with vaginal delivery and increased risk. Obviously, pelvic organ prolapse is one of them. But I think it's also important to not present it in such a way that it makes another birth mode like C-section sound like this green grass, heavenly place, because that's not great either. The one place I will say it's really not the most fun, and I can say that because I've been there, is like if you kind of have to do the better part of both of them. So if you go through, you push, induction, pushing the whole thing, and then you end up with a C. Like, that's the one where I'm like, we should have called that one a little bit sooner. But I digress. Anyway, point being, this idea of, I think, education, knowledge, awareness, that's where the conversation needs to start. But we also need to be aware that people are going to be at different points in this conversation. We're going to have people that aren't even thinking about birth until after they're pregnant. We're going to have people that might be thinking about it before pregnancy. We might have people that haven't even heard the word prolapse until it showed up on their medical record or their GYN mentioned it. And then you've got to kind of figure out where to go from there. Or you might be perimenopausal or menopausal, thought you got away from birth scot-free, and now all of a sudden you're feeling all these sensations down there because your hormones have dipped. And now you're noticing things that you never did before. So I guess all of that is to say that we have a lot of education to do. And I think the earlier we do it, the better to kind of head off some of this stuff long term. But I think it's really important that we meet people where they are. This conversation of consent, I don't think that's the right word. because it implies that, yes, I agree to the following. Like, no, no one knows. No one knows. There's things that are predictors, but again, like, we don't have the algorithm at this point. We don't have somebody that's going to say it's this percent chance that this is going to happen to you. There's just way too many variables with our own bodies, and then whatever goes on with the fetus and the newborn. But I would really love to kind of get everybody's opinion about, if you've given birth, what education you had before, what education you had after, what do you wish you'd known, what do you think you should have known sooner? Is it a matter of consent, or is it a matter of, we need to get this education in doses and probably in a mindset where we're more apt to take it and not necessarily blow it off? But also, is it a good idea to get in a mindset where you're just like scared of everything? Which I think prolapse is one of those things that happens with. So anyway, curious to what your thoughts would be about this and kind of what your experience has been, so we can pass that along to the women thinking about being moms and people who are already pregnant. So let me know.